It seems like there's not a day that goes by that we don't respond to some sort of mental health crisis where, somebody is just struggling or having a bad day and they're just reaching out looking for some sort of help or looking for some sort of resources.
The police department recognized an increase in mental health and chemical health related calls, and I think we realized that we can do better.
Case management is a group of officers and non-sworn personnel that are in place to help people in the community that may need help with medical resources, mental health resources.
It has to do with the actual case management of clients, which are referring them to resources, making sure that their care team or care providers are in the loop and aware of certain incidences that their clients might be experiencing. Some calls that I receive that are mental health related, one would just be a welfare concern or a welfare check type call. Sometimes people just call because they're not feeling well themselves, or a loved one might be calling that that the person is suicidal or thinking about hurting themselves. When I'm following up with a client after a call, sometimes I'll call them, but a lot of the times a few days after the call, I will physically go to their house and meet with them. And I think that's important to physically see me instead of talking to me on the phone. That way, again, they can kind of visualize me. I'm usually in an unmarked squad car. I dress in khakis and a polo, and it doesn't really have the police feel to it. And I think that's important. And during that follow-up is when I'm collecting the information. I'm talking about services that are available, and a lot of the times it's just simply checking in with how are you doing, and is there anything that us as a police department can do to make your situation better.
We as a team or a department can proactively get these people resources that they need. It reduces the incarceration rate, it reduces the hospitalization rate, and it reduces ultimately the calls for service that are generated.
If you polled a large amount of police officers, we all got into this job to help people. But I think this is almost taking it one step further, where we're not just helping people with their item that was stolen or the car accident that they got into. I think this is actually helping people better their lives and having a positive outcome.
I just think we're on the tip of the iceberg with this. Nationally, internationally, we would love to see social workers embedded in our program, medical professionals embedded in our program.
You don't want to hear that typical they fell through the cracks type situation. I wanted to be part of a team where I could say, I've done everything I could do as a police officer.
The future is big and bright with this program.